The bowels of the abdomen, specifically the stomach and intestines, during the digestion, emit sounds originating from ripple movements that occur in the walls of the stomach and the small and large intestine sought to push their contents of food, fluids, and gases forward through the digestive tract, and those sounds in the natural state are of low musical melody. The severity is that our ears do not hear it, but if it is loud and heard above it, it is called the borborygmi, and there are those, and the borborygmi is often benign and not dangerous and indicates that the digestive system works well. Symptoms associated with the borborygmi. There is no harm in hearing the borborygmi from time to time, and at intervals provided that it does not coincide with digestive symptoms, and in contrast, if the borborygmi coincides with other symptoms, it may reflect emergency conditions that need to be intervened to avoid potentially unnecessary serious complications, including fever, nausea, vomiting, constipation, frequent diarrhea, bloody stool, heartburn does not respond to medical treatments, the feeling of fullness of the abdomen, pain in the abdomen, causes of abdominal borborygmi, movement of food and liquids, and digestive juices and gases through the hollow gut, which most of its walls are made up of muscles. When the channel is filled with food, occurs a sequence of contractions and diastolic in the muscles in order to mix food and pressure it as it passes through the intestines to be digested and pushed. The latter is responsible for the roar of the village that comes to our ears after eating or after a few hours of eating or even while sleeping. Hunger. According to an article published by Endocrinology and Metabolic Clinics in North America, when you feel hungry or once you see food or even smell it, the brain sends hormone-like substances to the stomach and intestines to prepare for food reception, and the stomach begins to produce digestive juices, and fluids do not find food but air, so fluids interact with the air and we hear the sound of the borborygmi. The borborygmi is classified according to its strength, natural, incomplete, or hyperactive, and the deficient borborygmi indicates a slowing of bowel movement. In contrast, the overactive borborygmi reflects a vigorous intestinal activity that emits a melody that can be heard by others, and this melody is usually heard after eating or when diarrhea. There is no doubt that the deficient or hyperactive borborygmi that occur from time to time are normal, but if they are repeated and coincide with other symptoms, they may indicate a medical problem. Medical reasons. Besides digestion and hunger, many pathological causes can stand behind the borborygmi. Blockage of blood vessels that feed the intestines. Mechanical intestinal obstruction due to hernia, tumor or adhesions. Intestinal wrap. Cerebral palsy. Chemical defect in electrolytes such as potassium deficiency in the blood. Infection. Shock. Perforation of peptic ulcers. Abdominal cavity infection, peritonitis. General anesthesia. Abdominal radiation. Spinal cord anesthesia. Medications that suppress bowel movements. Partial or total intestinal obstruction. Abdominal surgery. Diarrhea. Crohn's disease. Food allergy. Gastrointestinal bleeding. Microopathy. Ulcerative colitis. When is the borborygmi dangerous? If the borborygmi is limited, it means that digestion is going well, and the severity and nature of the borborygmi depend on the activity of the stomach and intestines. But borborygmi may be associated with symptoms such as pain, colic, convulsions, nausea, vomiting, constipation, diarrhea, rapid weight loss, acidity, and infectious heartburn, and watching blood in the stool. When such symptoms appear, it is necessary to consult a doctor for medical examination, and possibly request other tests contribute to putting points on the diagnostic letters, and therefore prescribing appropriate treatment. On the biography of the diagnosis, Australian researchers have devised an easy way to diagnose irritable bowel syndrome by analysing the melody of the ulcer released by the bowel movement, and this method was presented at the Gastroenterology Week held in Washington in 2018, and the researchers said that listening to the sounds of the abdomen, borborygmi, It can improve the diagnosis of the syndrome referred to using the method of acoustic sensing to monitor sounds through headphones worn in the form of a belt in the middle of the abdomen, and the researchers noted that this method allows the monitoring of irritable bowel patients correctly in 9 out of 10 cases, which are promising results carrying news X for millions of infected people around the world who endure months and years of tests and questionnaires before your doctor can make the right diagnosis. How to treat the borborygmi. The borborygmi, which reflects the sounds of the natural intestine, does not require any treatment, and the tone of the tick may be high, in which case it is sufficient to legalize the consumption of gas-producing foods to reduce the high tone, including legumes, fruits, industrial localities, soft drinks, whole grains, some vegetables such as cabbage and broccoli, dairy products for lactose intolerance. It is also recommended to refrain from chewing gum as it increases air transit to the digestive tube and to tame and chew food well, and those with irritable bowel syndrome can take probiotics. Borborygmi and medical emergencies. If the borborygmi warns of a health problem, it should be treated according to the instructions of the doctor, and specific medications are prescribed for some digestive diseases that stand behind the borborygmi, such as Crohn's disease and ulcerative colitis, while cases of gastrointestinal bleeding, intestinal damage and acute intestinal obstruction, you need to be admitted to the hospital. In serious bowel injuries such as bleeding, perforation and total intestinal obstruction, it may need surgery to correct the problem. What are the expectations for the borborygmi? In most cases, expectations depend on the severity of the problem. The natural borborygmi is not a cause for concern, but if the borborygmi is unusual or accompanied by other symptoms, the immediate request for medical care reduces the risk of complications, but in some cases there are life-threatening complications if left untreated, and clogged the intestines can be very dangerous because it leads to tissue death in part of the intestine due to a breakdown of blood circulation, and also, any rupture in the walls of the stomach or intestines can lead to inflammation of the abdominal cavity that can be fatal.